My name is A.Heric, and I will be discussing scenario B for my video. Mrs. S is a 72-year-old retired school teacher who lives alone with her dog Ginger. She happens to be a very independent woman, and one day while she was shoveling snow on a Monday morning after a very big storm, she developed a crushing sensation in her chest. Now, this is not the first time she had this chest pain. Mrs. S has a history of angina, and though she's never had a heart attack, she does take an aspirin every single day at home and keeps a nitroglycerin tab in her pocket just in case. Mrs. S took a nitroglycerin tab and an aspirin and drove herself to the hospital after she was shoveling snow. She was admitted to the hospital on Monday afternoon with chest pain. At this point, we have ruled out a myocardial infarction. She has been a patient on the cardiology floor for 4 days now. She has no chest pain since Monday, and we have ruled out for a heart attack. She has an IV of normal saline and is expected to go home in the morning. At 2200, Mrs. S put on her call light. Nurse Sue has answered the call light, and Mrs. S states that she's having chest pain again and rated her pain a level 9 out of 10 on the pain scale. Sue, the nurse, had a PCA check her vitals and an EKG. Sue, the nurse, went to go get her nitroglycerin tab. Mrs. S's blood pressure was a 90/52, and her EKG showed ST changes. Her heart rate was 120, her breathing was labored at 36, and her pulse ox was at 85 on room air. Sue, the nurse, gave Mrs. S a nitroglycerin tab sublingually. There was no relief to her chest pain, and her blood pressure decreased to 80/52. Sue, the nurse, placed Mrs. S on oxygen at 2 liters, and her pulse ox improved to a 91%. Mrs. S is still very anxious and states that she feels terrible. Sue, the nurse, increased her IV fluids to 100 cc's per hour and then proceeded to call. A few things to keep note of in this scenario. Mrs. S has already taken her nitroglycerin, she's already taken her aspirin tablet, and none of it seems to be helping. She definitely keeps her nitroglycerin tabs handy just in case, and this is not the first time she has felt this way, so we definitely want to look into her history and see what could be the cause or where this might be coming from. Betty, I am so glad you're here.
How was night shift?
Well, I got a few things to tell you about Mrs. S.
Oh no.
Yeah, it was pretty rough for her, so hopefully you can help make her feel better.
Okay.
Night shift was a rough one, so good luck to you today. We've been practicing S-bar technique. Dr. Hopka really recommended it, so we've been utilizing it on the floor, and it's really helpful. So let me just fill you in on what happened with Mrs. S. So the situation is that Mrs. S came in due to some chest pain 4 days ago. I know you haven't been here, so she's been doing all right. Her symptoms have decreased along with her pain level, so that's really good. She is actually in room 3 over there, so be sure to drop by and say hi and introduce yourself at least. She might be sleeping though. The background, so it's very important to note that she's very independent, so she might not really want your help, but let yourself be known. She drove herself here.
Wow.
While having chest pain. So she took her aspirin, her nitroglycerin, and she drove herself here. So good for her, but we definitely want to treat her. So we were able to rule out myocardial infarction, so that's good. Turns out she was shoveling snow at the age of 72. So hopefully we can get some help in her house. So for the assessment, we were able to rule out a myocardial infarction, like I said, which is good. However, at 2200 last night, her pain was back to a level of 9 out of 10 when we thought that she was getting ready to go home. I noticed that her blood pressure was at a 90/52 and that her heart rate was 120. She also had labored breathing at 36 and a pulse ox of only 85%. So with that, what we recommended take place is we gave her a nitroglycerin tab sublingually, and we put her on 2 liters of oxygen just to boost her levels, and she was up to a 91%. So she states she still feels a little bit anxious and a little bit terrible. So I would definitely recommend increasing her fluids to maybe 100 cc's per hour. Definitely call Dr. Hopka and see what she recommends, and just keep a close eye on her vitals to see if anything should change.
All right, sounds good.
Awesome. Hey Betty, I'm gonna call Dr. Hopka for you before I go.
Okay, thank you.
You're welcome.
Hello?
Dr. Hopka?
Yes.
Okay, I have a little bit of a situation with Mrs. S in bed 3. This is Nurse Sue. I definitely just want to fill you in, and hopefully we can change her order. She came in 4 days ago with some chest pain, and last night at about 2200, she seems to have a level of pain of 9 out of 10 again, just when we thought we were getting ready to release her. And it looks like her nitroglycerin tabs are not effective. Her pulse ox dropped down to an 80, I think it was an 85%, and we're finally back up to a 91, which is looking better, but the nitro tabs are not working. So what do you think about ordering a nitro patch instead?
I think that sounds good. I will go ahead and rewrite the order to a nitro patch, as the tabs seem to not be bringing her much relief. Great suggestion.
In this section, I will be debriefing the video a little bit. So my thoughts on the scenario is things like this happen all the time. The elderly typically know what to look for. They're their best judgment. So with Mrs. S, she keeps nitroglycerin tabs on hand just in case these things happen, and that's a great thing. However, she probably shouldn't be on her own if it's something that happens regularly. What could be added to the S-bar? Definitely a little bit more of her patient history as well as her family history to see if this is in her background or if this is new onset, and see where that's really coming from. What do I think is not needed in the S-bar? While recommendation is obviously important and the nurses have a big role in patient care, I think that most hospitals and clinics already have chest pain protocols to follow. So I think that if anything were to be eliminated, that would be that, as there are already set guidelines. If we did this again, how would the scenario be different? I would just recommend much more detail, as we kind of filled in the blanks as we went along. And last, do I believe that the significance of the situation was clearly presented to the doctor? I do. The S-bar is a great technique to really break down the scenario to the doctor, to let them know exactly what's going on, the background, the assessment and findings, as well as what we as a nurse would recommend. So I do believe that the scenario was presented clearly, and that way the doctor can make their own judgment on the next plan of care for this patient.